we will talk about herbs for lactation. I'm sure it's a very interesting topic for many women. It creates a lot of anxiety and confusion, especially when you have a newborn and everything is so new, especially the first time moms. I know I went through that myself. And there's a lot of anxiety as to what's going to happen, how is it going to happen. So I hope that this little information that we provide in today's session will help you a little bit. So let's understand what lactation is first. Lactation is described as the secretion of milk from the mammary glands or the glands situated inside each breast, and the period of time that a mother lactates to feed her young. Normally, lactation is triggered by a complex interaction of hormones that happens during the final months of pregnancy. So it's very common that some women would see exudation of a white discharge or yellowish discharge even before the baby is born. And that is because the process of lactation has already been triggered in the body. But some women only get that lactation reflex once the baby is born. So lactation, although is a natural phenomenon, but sometimes mothers can have problems, including low milk supply, delayed onset of lactation, clogged milk ducts, certain infections, hormonal problems, and some anatomical problems that can cause problems for lactation. So there are many techniques which encourage and stimulate lactation process for the mothers and child. But in this session, I would discuss some herbs that can boost milk supply for the mothers in a safe and natural manner. So let's look at the slide. The first one, as we can see, is Fenugreek. It's a very common spice, and it is one of the most popular galactagogues among nursing mothers. It helps in boosting the milk supply in nursing mothers. It is, as per Ayurveda, it is pungent and bitter in taste and has hot potency. It balances Vata and Kapha doshas, and this herb is used during breastfeeding. Now, let's see how to use this herb. It's very commonly available, so anybody can use it at home. And I will tell you exactly how to use this herb. Around 3 to 6 grams of the seed paste, right? So that would be around 1 teaspoon of the seed paste or seed powder can be taken once or twice in a day. It can be made into a medicated milk by using 5 to 8 grams of overnight soaked fenugreek seeds. And then this overnight soaked fenugreek seeds is cooked in milk, around 200 ml of milk. And then this milk, medicated milk, is consumed in a day. And this is done daily over the period of lactation or nursing. Some people do not like the taste of plain milk, so they can add jaggery for taste if needed. And fenugreek can cause a dip in glucose level. That means it can cause hypoglycemia. So people who have low glucose problems, they should be careful when they are taking fenugreek, because it might lower the glucose level. So before having this medicated milk or having fenugreek, it's advised that you have good meal so that the glucose level does not dip too much. And sometimes it's also seen that fenugreek can cause gas in the mother and child. So if you have such a problem, then probably you might not want to take it, or you might take it in a lower dose. It should be taken, caution should be taken by people who have bleeding disorders, because fenugreek does aggravate bleeding disorders. Because it's hot in potency, it increases pitta. So in that, if somebody has bleeding disorders or are on blood thinners, then they should take fenugreek under the guidance of a primary care physician or any medical professional. And it has mild laxative effect. So seen in some people, not always, but it's very mild laxative. But in case you are suffering from any kind of diarrhea, then you need to be careful as well. But in general, fenugreek is a safe herb. It can be incorporated in your daily diet. or as I said, it can be used in these two methods. Either take the powder or paste of it with water, or make it into a medicated milk and have it every day. Generally, when you see it in the market, like in the stores, you will see it as seeds. I'm not sure if it is available in powder form as well, but if you're not able to find it in powder form, it's very simple to make it into a powder or paste. You just need to dry roast it a bit, grind it in a grinder and store it in an airtight container and use it as per need. The next herb is the fennel seeds. Again, it's a very common spice. Most of us might have it in our kitchen. This herb is good for improving milk production and stimulating milk ejection reflex. So milk production and milk ejection reflex are two different things. Milk production is basically the glands produce the milk and store it in those mammary glands, and then when the infant suckles at the nipple, the milk comes out. And the milk ejection reflex is when the milk is full in the breast. There is a tendency, it's called the let down process actually. So it's a natural process. When the breast is full of milk, there is a natural ejection reflex, and the milk starts dripping. That's why mothers who are nursing regularly, they will have wet breasts. So as people who do not have that reflex, then when the baby is sucking at the milk, it's difficult for the baby to get the milk initially. The baby might have to suck a lot to initiate that reflex. So fennel seeds actually help improve that reflex. So this herb should be used again during breastfeeding. And as per Ayurveda, it is sweet and bitter in taste and has hot potency. It alleviates vata and pitta dosha. And the recommended dosage is 1 to 3 grams of crushed seeds. Again, these come in seed form, so you can crush it. Or if you are able to chew it like that, it's fine as well. But generally, we make it into a decoction, so it's easier to take. 1 to 3 teaspoons of crushed seeds are steeped in 240 ml of water, and it's taken throughout the day. So that's also a very simple way of taking fennel seeds during lactation. The third herb is a shariva. It's known as Indian sarsaparilla. It is classified in Ayurveda under the group of herbs that cleanse and detoxify breast milk. Thus, it helps in conditions of clogged milk ducts and certain infections. It's very normal, and generally we see it in a lot of mothers that they have clogged milk ducts. The reason is, there can be many reasons. Sometimes there is a lot of milk and the infant is not drinking enough, and it clogs the milk. Sometimes the milk is really thick, it can clog the ducts, and certain infections can aggravate these problems as well. There could be tenderness in the breast, there could be swelling and painful lactation. So shariva actually helps in detoxifying the breast milk if there are any infections, and it helps in declogging the milk ducts. It is sweet and bitter in taste and is cold in potency as per the Ayurvedic pharmacopoeics. It balances all the 3 doshas, and the root of this herb is used for its medicinal purpose. This herb is usually made into a decoction using 1 to 3 grams of root powder. It is boiled in around 400 ml of water and then reduced to 100 ml. That's the basic standard way of making any Ayurvedic decoction. We always use 4 times the liquid and reduce it to 1/4. So if we want 100 ml of a decoction, we take 400 ml of the liquid and then boil it until it reduces to 100 ml. So that's how it's made, and it's very easy. You just need to add the 1 to 3 grams of the root powder in 400 ml of water and reduce it to 100 ml. Let it cool down, and this is consumed throughout the day. So the 100 ml is per day, and you can use it throughout the nursing period.
And you can use it, do it yourself, right? I mean,
we can do it yourself. Yes, yes. If I'm not sure if Shariva as is available as a single herb, I need to do some research on that. But if it is available, this is the best way to take it if they want to take it as a single herb. And the fourth one is Can's grass. And this herb is mentioned in Ayurveda to improve the quantity of breast milk in lactating women. It is sweet and astringent in taste and is cold in potency. It alleviates vata and pitta dosha. Again, its root is used for its medicinal purposes. The root of Can's grass is boiled in cow milk and given in a dose of around 60 ml per day to lactating women to improve the quantity of breast milk. So again, it's the same formula. The powder of Can's grass is boiled in cow milk. 1 cup of cow milk, around like 200 ml of cow milk would be good. Boil in milk for around 5 to 10 minutes so that the herb is infused into the milk. Then it's strained and cooled down and then is taken. So that was for Can's grass. And the final herb today is butter tree or honey tree. In Sanskrit, its name is Madhura. It's butter tree or honey tree in English. It is sweet and astringent in taste and has cold potency. It alleviates vata and pitta and increases kapha dosha. The medicinal part of this tree, this tree is used in many other problems as well. The bark, root, and flowers are used, but for lactation, the flowers are the best for medicinal for lactation purposes. So the flowers of this tree is boiled in milk and added with sugar and given in a dose of around 50 to 60 ml per day to treat low milk supply in lactating women. So these were the 5 herbs that we were discussing today. Generally in Ayurvedic practice, we have all these herbs, in one formulation, which is called Stanya Janana Rasayanam. And it's a part of the Ayurvedic herb package that is advised during postpartum period. So Stanya Janana Rasayanam has all these, and there's some other herbs as well. And it's a rasayana form, so it's in a jam form. It's easy to take, just 1 teaspoon twice in a day with milk. That helps. So in case you are not able to get the single herbs, you can get the formulation, and that is also very easy to take. Generally, there are no contraindications. It's safe to take during lactation, and it's safe for babies as well, unless there are some other complications. Then you need to discuss with your Ayurvedic practitioner or your PCP. But other than that, there are no major complications.